Vijay, now it's your turn. Tell us about yourself, about your past, about your present, about your amazing experience and developing your career. Yeah.
Yes, thank you, Matthias and Sophia, for arranging this meeting, arranging this webinar, and welcome everyone for the webinar here today. My name is Vjay. I've been in UK for the last 15 years, and I started as an international student, came here to study my master's degree, finished my master's degree, then joined in as a band 5 physiotherapist in a rotation, as Patrick explained. And then from there on, I worked for a couple of years, then moved on to a band 6 level. I worked for a few years, then moved into a band 7 more clinical lead role. And then from there on, I've just moved into a band 8, which is an advanced practitioner role. What I want to discuss today is to give you a brief introduction and discuss about how my career pathway has taken me from being a student to all the way up to a band 8 at the moment. As you guys have, like, one of the questions which you just asked about language barrier, that was the main issue when I actually came into UK. Like, in most part of the world, everyone teaches in English. Everyone knows how to read, how to write. That's not a problem at all. And even in my country, I used to think I'm really good in English, but once you land in UK, once you talk to someone who actually talks here, it's totally different. And to give you an example, the first day in my university, one of the people who register students asked me, like, "Are you okay?" But I heard, like, she's asking my name, and I said, no, I'm not okay. My name is Vjay. That's how bad I was when you start with. But as you could see that you grow in experience, you grow in confidence. There's lots of different things that comes into it. As Matthew said, it's all about getting over that barrier. Once you cross that barrier, then makes things much more easier. People here are a little bit, how do I say, they say, like, oh, you said that wrong. There are people who actually correct you. So it's really good to have that circle of friends around you to actually help you and improve. Back to the career part. As a band 5 physio, when I was studying in London Metropolitan University, I did my master's in sports therapy, and my bachelor's degree was in physiotherapy, which was in India. I came to England. I studied my master's degree, got qualified. When I was studying, I actually worked as a physiotherapy assistant, as a therapy assistant, as a band 3. So I already had an experience working in NHS to know how the system works in NHS, because it's every country, as Patrick mentioned, is very different to how the system works in each country. And because I already had the basic idea of NHS works, once I finished my degree, it was easier for me to take the next step into it. But when I finished my degree, I straight away didn't get the band 5 degree. I have to do a small period as a band 4, because that's the time I applied for my HCPC registration. And I'm pretty sure Matthews will talk about HCPC registration in a bit, so I'm not going to cover that one. I'll move past it. So once you get HCPC registration, you can actually work as a qualified band 5 physio. So before your HCPC registration, you can't work as a qualified physio. So as Patrick mentioned, you can work as a band 3 or a band 4. So once I got into a band 5 degree, I got into a rotation post. I rotated into inpatients. I worked in musculoskeletal. I worked in neuro. I worked in community. And I also worked in pediatrics. How the system works is, like, in a rotation, you work in a certain department for a period of like 6 to 9 months, and then you go into a different department, and then you work there for 6 to 9 months, so that you're working in different departments, so that you're getting all that experience and exposure of seeing so many different patients. And that's where you actually build your confidence, build your knowledge, build your experience in seeing so many different patients. So once you completed a rotation, then all the junior physios starts to look up for the next banding, which is the band 6s, which are a senior physiotherapist. As Patrick explained, senior, as the word senior comes in, it has lots of responsibilities than a band 5. So you supervise band 5s, you supervise a band 4 technicians, you supervise a therapy assistant, and sometimes you're asked to cover the team when your team lead's off as well. So band 6 has lots and lots of responsibilities. And that's why we always recommend for anyone who has less experience in management side to start as a band 5 when coming from abroad, so that you get that experience as a band 5, then you can slowly progress into a band 6 rather than going into a band 6. On the flip side, there are people who already have clinical experience or managerial experience, and those people can actually go straight into band 6. And I've seen, as Patrick mentioned, I've seen staff who have done it as well. So it depends on how qualified you are and how is your experience working with it. And once you're in the band 6 position, then there are from band 6s, there are lots of different avenues to explore. There are part where you can go as a specialist practitioners, and you can go to specialist practitioners like musculoskeletal practitioners. You can go into neuro practitioners. You can go into Parkinson's practitioners. You can go MS practitioners. There are psychology practitioners, mental health practitioners. There are so many different band 7 opportunities available, and each of them are specialists in their specific areas. And also, if you're not into any specialty, you can actually move into a band 7 more admin role or managerial role as well, which is a clinical lead physiotherapist. So there are different avenues to explore as a band 7, and it also depends upon what field you're interested in. Once you get to a band 7 role, and this is where you have to decide whether you're whether going into clinical side or you're going to managerial side, because they both are completely different. But from band 7 level up from band 7, there isn't much scope for clinical, apart from if you want to study and get another qualification, then you can go into advanced clinical practitioner role, which I'm trying to do it at the moment. I'm studying masters in advanced clinical practitioner in University of Brighton. And once you get to your qualification, you are an advanced clinical practitioner, and you can work in inpatients or community hospitals, GP surgeries, or community services, all the service as an advanced practitioner, which is on top of physiotherapists, all the responsibilities. You also get the responsibility of training your junior staff, and you can also prescribe medicines. That's one of the key things as an advanced clinical practitioner. That's one of the key things you should be learning at that role. But if you don't want to go into clinical, if you want to go to managerial, then you can become a team lead, and you can lead a team to perform better. And that's the band 8. That's what happens in a band 8 level in the NHS Trust. And as Patrick mentioned, in band 8, there are 3 separate divisions, band 8A, 8B, and 8C. And band 8B, from band 8B and stuff, you go into more of a director for NHS, and band 9 is kind of like managing director or director for NHS. So that's full admin or full and full managerial stuff. So up to band 8, you can be clinical. So this is my part. I've gone up to band 8 now, so I've just got into band 8. So I'm thinking I'll stick with the band 8 because I'm not that much of a managerial person. So I'll stick with band 8, and that should be me done for the day. Any questions so far?
Yes, of course. I have plenty of questions, Vijay.
Yes.
There's a lot of related to DPD, so Doctor of Physiotherapy. That's title coming from India, I understand.
Yeah.
Um, from your experience, because maybe you would know answer, can people from other country that studied and completed 5 years of DPT, can they go for internship to the UK? Do you have any experience on that? Whether they can or cannot.
As far as I can remember, DPT is Diploma in Physiotherapy, and there is another one
Okay.
called BPT, which is a Bachelor's in Physiotherapy, and MPT, which is Master's in Physiotherapy. So there are 3 different
Okay.
qualifications there. If you
All right.
have a diploma, if you have a diploma in physiotherapy, then you can work as a band 3 or a band 4 therapy practitioners in UK. You need
Okay.
to have a qualification, either bachelor's or above, to get into a physiotherapy department from band 5 and up above. So that's the demarcation line between there. But
Mm-hmm.
so if someone's finished a diploma, I would advise them to apply for a band 3 therapy assistants or a band 4 therapy practitioners. But this is where the problem comes in, where some of the NHS, about 70% of them, don't actually sponsor for band 3 or a band 4.
Mm-hmm.
And the NHS Trust, they start sponsoring from band 5s. And if I'm right, there is also a visa restriction for pay. This is the amount of pay they should receive for a trust to sponsor them to actually work. And I think, I might be wrong, but correct me if I'm wrong, it starts from a band 5 level. Yes, yes, you can, because my bachelor's degree when I did it was 5 years. I did it in India, then I actually applied for a master's degree in UK, and then I came here. But if you have a good bachelor's degree and you have a couple of years of experience, once you get your HCPC registration, you can work in UK. Yes, you
Hmm.
can. That shouldn't be a problem at all. If you're
And
thinking of doing your internship, then that comes up as a different criteria. That needs to be an agreement between your university and the workplace here. And I think
Mhm.
that might be a little bit difficult for an international student to do an internship here. But I'm not going to say no, but there are chances for them to do. But it's again, it should be an arrangement between your university and the trust here. Speciality depends on what you like.
Mhm.
I studied musculoskeletal physiotherapy to start with as my master's because I did my sports therapy. But I completely worked in the community looking after elderly and frail patients. So that's totally exactly opposite to what I actually did my master's in. Because what I studied is totally different because I like the work I do in the place I live in. So it's there are lots of different factors to the speciality. But if if you ask me what's the best one, again, it'll depends upon what are your conditions and what you're expecting from the job. Say, for example, musculoskeletal, if you take MSK, you'll be office based and the patients come to you for treatment. So that could be, you could be a musculoskeletal specialist sitting in an office where a patient comes to you for the whole day. And you might be seeing about 10 to 15 patients in a day. So that might be the role that's more suited for you. But for an outgoing patient, outgoing therapist who doesn't like to be sitting in a chair, he would like to work in a community where he can actually go out, drive to a patient's home and see them at the patients at their home to treat them. So that's the different specialty. It could be a frailty specialist or it can be a neuro specialist. So there are different specialty, but what specialty is the best depends on what you want to do. And from my experience, I preferred working in the community because of the flexibility of the job that offers me. I'm not one of those person who sit in the office all day and see patients who comes in and goes. So I like to be out with the patient, walking with them, doing how they're actually doing it, looking at their home, saying, oh, they have difficulty getting on and off the bed. So what I can do for them to do it. So I'm more of a practical oriented patient, practical oriented therapist. I'll take the patient out of the home, get them into the car to see whether they have any difficulty getting them into the car, out of the car. So I look at more of a holistic therapy rather than just focus on just musculoskeletal. That's where my skill is. So I like working in the community. So, but again, it differs from patient to patient what their experiences are, or what their specialty is, or what they want to specialize in. So I can't give you a straight answer for that one.
Mm. Yes, I agree with it must be kind of preferences which area you prefer. However, as Patrick explained before, there are also rotations, so you may have experience in different areas, and then you eventually you'll land in the one that suits you best.
It is. I don't think it'll be if you're doing your master's degree in physiotherapy or what you did a bachelor's degree in. I don't think it'll be any difficulty in you getting a job. The only thing I would say you need to do is when you are a student, you need to have register with HCPC as a student member, and then once you qualify, then you can actually move that student member into a professional membership with HCPC. Once you've done that, then it's a matter of you applying for a job in different trusts to see which one's suitable for you so that you can get into it. So I don't think it's going to be difficult for you to get a job after you're qualified. And this is where Patrick mentioned about you can apply for a band five job where you get into a rotational post where you work in so many different departments to know how each department works, and then you decide where you're gonna stay or where your interest lies in. Um, HCPC is very important, and try and get that experience as much as possible and the exposure as well. Even when you're studying, as I mentioned, what I did, try and apply for a job even when you're studying as a part-time therapist or part-time therapy assistant, what it does is it gives you that experience of attending interviews and answering questions in front of so many different people. And even though the banding is different from a band 3, 4, and a 5, the interview questions, if you look at NHS, it's almost similar, but with some changes for 4 or 5 questions. So each NHS interview questions will have trust value questions, which are almost exactly the same for banding 3, 4, 5, and 6. But the other questions, like 4 or 5 questions, would be exactly different depending upon which banding level you are. So, as Patrick mentioned, is one of his hobbies for attending interviews. It's easier if you've attended 2 or 3 interviews, and even though you're not successful, you can get into the next one straight away, and when you want it, you'll get the job. I would say it'll be fairly straightforward.
Do I have to clarify something? You don't need to finish your master's degree to register with the HCPC. So someone who got a bachelor degree from India, for example, or Pakistan,
Yeah.
they can apply for a master's degree and for the registration at the same time, so they can study and work at the same time. So
Yes.
just a clarification.
Yes, that is a good point. You can study and work at the same time, but if there might be some visa complications for it because as a student you're only allowed to work as a part-time, and so I wouldn't recommend you working more than the allocated time for you to work. But as Sophia mentioned, you can
Yeah,
work.
you just mentioned that registering with HCPC as a student. It's
Yes.
it's not really about
If you already have a qualification, bachelor's qualification, and it's accepted by HCPC, then you can very well register as a qualified therapist, and then you can start working.
yeah.
You can apply, go straight and apply for a master's degree. That shouldn't be a problem as long as you have a bachelor's degree. Some universities are a little bit strict in accepting master's applications straight away because they want to see the transcript for your bachelor's degree, and they want to know what's actually covered in your bachelor's degree and what's not. Once they know like what's covered in your bachelor's degree, I mean they're happy with it, you can go straight into a bachelor's degree, master's degree. There is a chance, yes, you can.
Hi, can we apply for an HS interview without HCPC registration and do the registration after the interview? Patrick,
No.
that question I would address to you. I know from my perspective, from my brand, from ambulance service as a paramedic, I know trust some ambulance services providing interview process. And letting the candidate go through interview process, and when if they're successful, they let him to approach for a to complete the HCPC registration. Is it same on your side? I mean, on our physiotherapy side, the
If you look at the personal specification of the job, registration with HCPC is essential. So that needs to be you need to have it to be shortlisted for the interview. Am I right, Vijay? Is that correct? Because you were
Yes, it's one of the specifications that
Yeah.
you should have an HCPC to come as a band 5 level. But there in the past there have been a few candidates who have got the job as a band 5 before they get the HCPC registration. But once they got the interview and got the job, they weren't offered a band 5 position because it's legally we can't actually provide them a band 5. So what happened in the interview was they asked them and they said they have applied for HCPC registration and they're waiting for the HCPC to come back to them with the registration number. So in that case, what happened was after the interview, they got appointed as a band 4. They worked as a band 4 until they got the HCPC registration, and once they got the HCPC registration, they moved into a band 5. One of the things that in UK they actually look out for in every CVs and in every application is for a gap between your practice. And if the having a gap between practices is quite normal. It's not a problem unless and until you explain it and say this is why the gap was there, and that you've been actively doing some reading, actively doing some other stuff within that 6 months period. And they might ask you to write a reflection or a CPD, like how you are kept up to your professional standard of practice. So if that's available, then you can get a job, even though there is a gap between your professions.
I have 5 years of experience, and I'm HCPC registered. I have worked in an acute hospital, done home visits, attended health camps, and currently working in a private clinic that is affiliated to a hospital as well. What are my chances of getting a job? I think more looking at that question, the chances are great. But what do you think, guys? That
I think
sounds
I think there's a really
quite
good chance
impressive.
that you'll get the job.
Mm,
Yes.
mm,
Again, it's apply for a job
mm,
and see how the interview goes. Because as Patrick mentioned, interviews in UK is all about point-based system. So
mm,
for every questions they have this certain number of points which they allocate, and depending upon whether they prompt for you to get the answer from the deduct points. So every time you go into interview, you already got about like 50 points for your interview. They start to deduct points rather than adding more points onto it. That's how the interview system works. So the more you say, with your experience of 5 years and the degree of the HCPC registration, there is a great chance that you'll get a job in UK.
mm. Okay, right.
Can I just add
Yeah,
something,
yeah.
please?
So sorry, Patrick. I'm not ignoring
Yeah,
you.
I'm just trying to go through. Because Vijay mentioned something about yes, applying for the job if you're not registered with HCPC, you're applying for Band 5, and they might offer you Band 3 or Band 4. This is what would like to add to the question about the language problem, language barrier. That's what you might be offered as well. I've seen it in my career. One of the physio from Poland actually, who struggled with English a little bit. He had experience from Poland, but his English was communicative. But the people who were interviewing him were not convinced if he's ready yet to assess patients fully, if he would understand everything he needs to be safe with the patients. And they offered him band 3 job for half year, for 6 months, and that was his time to learn. They supported him with English as well, so he was offered the English lessons, and they were working with him to improve the vocabulary, basically to get him ready for band 5. And after this 6 months, he went for the interview again. The job was secured for him anyway. And once he was ready, when the managers, they got to know him a little bit better, he was offered a job as a band 5 and then carry on as a qualified physio. So that's the ways you can get around sometimes if you got problems with some field like language, like HCPC registration. But the question is, that's what I'm thinking. If you're not registered, if you are going to be shortlisted for the interview, if they invite you for the interview, that's the first thing. So because if you're not registered and you got for the interview, that's a scenario for you. But if you get the job interview, that's the question. Thank you.
Hmm.
That's all.
Okay, Vijay,
Yes.
that was amazing. And I think you both guys are amazing example. But for people that love to progress even further in a career, your description of the master degree was fantastic. Thank you for that. Patrick, also going now for his band 7. Have you started yet, or have you hadn't started yet on the band 7? Sorry if I.
No, no,
Sorry.
no. I'm not going for band 7. I'm going for
No.
the band 6 post in Neuro
All
community. I'm
right.
starting next
I'm
month.
sorry.
So yeah, that's
Ah,
fine. I
yeah.
was applying for 7. I
So,
didn't get it.
right.
So
Okay. So there's
yeah,
where the
yeah. Band
confusion coming
6,
from. All
but
right.
I'm going to specialize in neuro, so community neuro team, which I'm looking forward to.
Okay. So, but this is the main thing, especially in a job in area of being a healthcare professional. We can't stand still. We need to progress. We need to progress in our career. We need to develop.